Hi guys, welcome back to Unique World. Welcome back to GMCM Talks. This is the episode 4 and this is super exciting for me because we are here with Dr. Sunil Sir, our associate professor at GMCM at the Department of General Surgery. First of all, thank you so much, sir.
Welcome.
Thank you so much for giving us this opportunity.
Right.
We have done this with students before, but this is the first time we are interacting with a faculty member.
Oh, nice.
So we are super excited to introduce you and talk about your early career with all the students.
Yeah, okay.
So, sir, tell us what got you interested into MBBS as a kid. As a kid, what was the passion behind joining this stream?
Yeah, okay. Actually, I have got 5 brothers in the family. Among these, all are doctors.
Okay.
And second thing is, my father wanted to make all study with the same cadre.
Okay.
Or like not to give other profession or give some other profession to others. So he wanted everybody to be a doctor. So all the 5 members in the family, whoever is there, everybody is a doctor in the family, and we don't have any girls in the family. All boys, all are doctors.
That is very interesting story, sir. So it was like destiny for you.
Yes.
From the moment you came onto this earth, that was how the story was supposed to be.
So actually what used to happen is every second year we used to have one guy behind the one who is in the front. Everybody used to ask what is the rank you are going to score.
Okay.
So every time what used to happen is, yes, I have to reach a better rank than what my brother has got. So whenever, even if I sleep in the night, if I wake up around 2 o'clock in the night, I used to see all these skull bones, everything there on the next bed.
Okay.
Who is there when in the night they used to keep on reading. Somebody, if I wake up in the 4 o'clock, another brother will be reading.
Somebody studying.
So everybody will be in the stage of studying and I will be sleeping partially. So every time there is every step, there is a target for every brother, the one who is in front of me, so that they have to get the seat.
Okay.
So, and above all, father was there. He was telling that no, we have to be a doctor, and there are few principles in him who has to save and have to give some service to all the patients.
So it was destined to be this.
Yeah,
for
it is
you.
already decided.
And you were also super passionate about
Yes.
from the days of your
Yes,
MBBS.
yes.
As a kid also, you had somebody to look up to.
Yes.
So that was there for you.
Yeah.
How were your UG days, sir, undergraduate days?
Undergraduate days, everything was a challenge. Why? Because I have to read. I have to perform better than my brother, because there is always a sibling competition. So all the professor who is there in front of me used to tell, your brother was good. So I have to prove myself that I am. I too have to be get a good word that I am also better or good in comparison to my brother. Why? Because everybody has put a target in front of me, so I have to reach them. It is again a tough job for me.
Yes, sir. So undergraduation was very competitive and you always had something to look up to, and it was a clear path for you.
Yes.
Sir, you were into sports and other activities also, sir?
Yeah, if I'm supposed to tell something about the sports, I have got the individual championship still unbeaten in the entire University of Health Sciences.
Wow.
I was in 100 meters, 100 meters first, 200 meters, 400, 800 meters, 600 meters, and high jump, long jump, and triple jump. Athletics. I even represented South India for basketball team.
Okay.
So actually we were tuned up with my childhood friends who used to be very much more in the sports.
Okay.
Like, so I have still my individual championship in my sports in NTR University. At the time it was NTR University, not KNR.
So it was
still it is existing.
Complete college experience for you.
Yes, full.
With respect to academics and also sports and
sports
other
and
activities also. With your brothers also with the sports.
Yes.
Okay. Sir, so how was the passion for surgery, sir? Where did that start?
Yeah, exactly. So one thing is, my eldest brother is a very good surgeon actually.
Okay.
He used to have very good skills of surgery. So all the skills I have learned from him. Then later I have one more brother who is a general surgeon from Jipmar. He's better than a super specialist actually.
Okay.
So even all the skills, surgical skills and all, they are very good in him.
Hmm.
So I adopted all the skills from him.
Hmm.
And after that, I improved my speed of surgery on my own.
Okay.
So the rules from them and speed from my inner own.
Passion ignited from there,
Yeah.
and after that you continued the passion.
Yes.
Because we have this confusion between medicine and surgery, and you have seen the trend from the last 30 years.
Yes.
So from your perspective, like taking up surgery.
The only thing is, whenever or whatever you are going to do, the only thing is you should be passionate towards your profession. There are a lot of people who take general surgery. There are a lot of people who take few branches of general surgery or surgical branches, and on the table they feel, why did I take this case? Why am I operating this case? If I would not have been on this table, maybe why should I take so much of stress? There are a lot of people who do surgeries with fear.
Yes, sir.
Whenever you do the surgery with passion, it will be enjoy.
Okay.
That is the biggest thing that everybody should know and come across. Why? Because everybody want to do, they take a subject which is not of their wish, but they do. Later what they do is, every day they repent, why I did take the surgery. I would have gone with some other branch which is not a surgical branch.
So you have no regrets for taking
Nothing,
surgery.
zero.
If you were again
Zero
starting
regrets.
the course, again you would do the same thing again.
No, I would have gone for orthopedic surgery.
Orthopedic surgery.
Maybe I would have been a better one. Even a lot of my colleagues, they say your surgical movements and your skills are even far good than a super specialist. So that is one big regret. Why what I feel is I would have done a super specialty. Yeah, just I missed it
Okay.
because of some issues.
Okay, sir. So, sir, how was your internship life like?
Internship was a great job. Why? Because we have all our colleagues, they were very competitive.
It is a very hectic period.
Yeah,
everybody are at the same level.
Everybody same level.
How?
Then thing is, all of them are competitive. They want cases. They want everything. If say, suppose what we used to do is, at the time when the guy is sleeping, we used to rush and get my chances there. So that was the thing. Suppose we were in a labor room 2, which we have lot of eclampsia cases and all. So all our girl students used to say, sir, madam, we are going to take rest by this time. By the next day morning, there will be a big list which were attended by me. They used to feel a lot.
Okay.
Why? Because I lost this case. So this is all what used to happen. But all things were very competitive.
You didn't feel it as a hectic job, sir? You
never,
enjoyed
never.
At every moment.
It was a very nice time. And second thing is, I used to spend a lot of time beyond my period more in the casualties, more in the ICUs, and wherever the cases which were there that need a lot of concentration on the cases, we used to attend that branches.
More than what was required by you?
Yes.
It was your personal choice?
My personal choice. Go attend the casualty, go attend the OTs, go attend the emergency cases, how they are tackling it, how best they are coming out with the results and all. That was very much helpful even in my own practice also.
Okay.
So that was a very good
because
thing.
we think internship is hectic and
No, never.
You didn't feel it like that?
Never. It was a passionate thing and it was a welcome thing that we enjoyed whole period of internship.
So your point was be opportunistic and try to take...
and grab the opportunity, not just savvy and wait for it. Just go and grab it, and opportunity you have to utilize it, so that otherwise you will not get any chance.
So we have to, whenever there is an opportunity...
we have to go to the seniors, go and ask them, sir, just keep on going. Whenever there is any, sir, is not adjacent to you, we used to slowly push them, sir, shall I do this?
So keep asking for chances.
Definitely. Unless you go and ask them for chances, nobody are going to give you anything.
So don't be afraid to...
Never should be afraid, because when you keep on pleasing with your senior or your assistant professor or your senior most or your HOD,
Yes.
obviously they will be constantly giving a chance.
Okay, sir.
Nobody is ready for that. Everybody want to stay away. It's
That's
not
why
like
I
they
wanted
should
to
not
ask
do
your
that.
perspective.
Yes.
You too wanted to take all
We
the
used to
opportunities.
have our seniors, we used to call them not as a sir, but we used to call them just simply like a brother or a sister. So that was the relation we used to have with the seniors. So whenever they used to, hey, Rick, come on, they used to call us and give the chances. So plenty of chances are exclusively given by our seniors, followed by our assistant professors and associates.
So how was your post-graduation experience?
Post-graduation, actually people say that if you do in an institute where you are the first PG and you don't have an assistant professor, you don't have an associate professor above you, and you don't have a senior PG and a junior PG with you, people think that you can't do anything. But once I started my postgraduate, then I found that there are plenty number of cases that can be done if you are interested.
Interested.
Yes.
So it is all up to you. Only.
Yes, if you, there is no institute that doesn't have chances. Every institute is the biggest asset for the candidate who want to learn the things.
Yes, sir.
If you ask me as a postgraduate how many VIPs you have done, yes, I did 3 VIPs till now.
Okay, 3 VIPs.
As a postgraduate, not less than some around 20 to 25 splenectomies, around 200 thyroids as a postgraduate. Yes, not as a consultant.
So it doesn't really depend on the hospital. It depends on how you are taking the opportunities.
How best you are going for the case. Even in trauma cases, blunt injury abdomens, even I have done around 20 to 25 splenectomies in trauma. That too with very excellent and very good results. And hypersplenisms, lot many.
Sir, where do you get the confidence?
The confidence should be inner.
Because this is a field where we question our decision every second.
No,
you don't have
no.
that.
One thing is, all the surgeons, whatever they want to do, what they should have everything in the idea. What are the complications expected when I go in? So we used to tell one word that abdomen is a magic box. Once you go in, it is a music box. Not music for the patient, it is music for the consultant. Why? Because what you want to do, what you are going to do is a big miracle. Whether you will be going home or not is a big question. So first thing is, we have to go in. Before going in, you have to have all multiple perspectives to think what is the outcome of the surgery. Then what are the complications expected out of the procedure? Then what are the bouncers you are going to face in the middle of the surgery? So these things, once you come across, you will be very much comfortable. Suppose you enter it and face the obstacle, then go into trouble, and you keep on searching who is my senior to rescue me.
Okay, so before going in only, we have to be... I remember this from our 4th year posting, sir, when you had got a call at 4 a.m. And you explained it to us that as a senior resident also, you have to be very accurate before going in, before exploring, and you shouldn't run to your assistant or associate professor every time after opening the case on the table. So this you learned from your post-graduation days only, which is very rare, I feel like, because it feels overwhelming for us.
No, actually I did my postgraduate only for a paper degree.
Okay.
Rest of the things I was very confident as an MBBS doctor, able to and capable of doing the surgeries. I took only my postgraduate paper degree, I want to say, in other words. Rest of the things, yes, I can do. I am more confident.
One question I have is, as a surgeon, is it the skill or is it the hard work, sir? Some people are born to do it, or if I am passionate, I will be able to do it.
No, you keep on doing the procedure. Many number of cases you get doing it, and you get more number of exposure. You will be more confident doing the procedure. Somebody say, one of our super specialist, when I was in oncology, our sir used to tell one word: you should not do the procedure. Like suppose a procedure is done for 8 hours. It is not that you have to do the procedure for 7 hours or 8 hours or 9 hours. It is one clear-cut issue that you have to do the procedure like a procedure. Suppose say you do the procedure in a particular amount of time, you have to see that it finishes by that time. One important thing is that you have the procedure like there are few things in the procedure. Suppose say one procedure you start, opening the abdomen is a mechanical job. Suppose you enter in, the key points will be very less. You have to spend more time in doing the key points in the procedure. After that, closing again is a mechanical job.
Okay.
People think like opening is a very big, messy task, big task. Once you enter the abdomen, yes, I have opened the abdomen. While closing again, it is a big mystery how to close and all. No.
But you don't approach it like that.
Never like that. The only thing is just getting in half minute or 1 minute or 2 minutes, doing the procedure 3, 5, 7 minutes, give more ample amount of time for the key steps in the procedure. Then closing, again a mechanical job. Just finish it as fast as possible.
Practice
the less amount of exposure of the patient to the atmosphere, the fastest recovery the patient has. So the outcome in the post-operative period will be excellent. Suppose you spend less time on the patient. Suppose you do a laparotomy in half an hour, 15 minutes. Suppose you compare a patient who is done laparotomy for 2 hours and compare a laparotomy done in 16 or 17 minutes, this fellow will recover very fastly. Why? Because patient will have lot number of complications which needs lot of correction before. So without that, it is good. So the time and approach and more number of cases, good exposure, make you more confident, more passionate, more easier and simple to do the procedure. One thing is that as a surgeon, what we need to do is, we should not enjoy the surgery. The onlooker who is seeing the surgery should enjoy what you are doing. This is actually the rule of surgeon.
That is like your philosophy, like while doing the surgery. Sir, do you keep a count of how many surgeries you do? Because it's been a very long course.
Actually I've done almost around 16 to 18 surgeries in one day.
16 to 18
18 surgeries in one day. That is the biggest count I made. Then I think I have reached around 1 lakh.
1 lakh.
1 lakh surgeries during this period.
Sir, because opening the patient on the table, it is a life or death situation. And for you, where do you get the belief in yourself when there is no superior and you are the person taking over the case? Because 1 lakh cases is a very big number. Where do you get the strength to believe in yourself to do? Because it's a life, every case is a life or death situation for you. And 1 lakh is not a small number at all. So where do you get the courage to?
I was very much interested in viewing the WWF.
WWF.
So whenever you see WWF, there are two strong players in WWF. One is Undertaker and another is Kane. And if you keep on observing the fight, in the middle of the fight, suddenly this fellow, the opponent will hit the Undertaker and this guy will fall down. This guy will be enjoying that he has won the shot. After few seconds, if you turn back, this guy will
wake up again.
And he is ready to hit him back. So one thing what it exactly happens is, if I have done, suppose I have done 7 surgeries today and I think I have to relax today, then if I get a call the next minute, I feel I am getting the call for the first case. Not that I am going for the 8th case or 9th case. I feel and I get the strength as if I am going for the first case.
So you don't keep count, I am tired, I did 10
If you get the call at 2 o'clock in the night also, I feel I am getting the first call of the day.
With that much attention, you have to do every single case.
Single case. So that comes only with when you are more passionate of the surgery. Suppose if you are fearing to do the surgery, you will not like it.
Burden.
You will feel a lot of burden.
Sir, we've talked in the perspective of a surgeon. Now I want to hear the perspective of a teacher. And before telling that, I want to give you a small statement. In 3rd year, when we started our final year MBBS, you came to our class and I still remember this quote that you said on the stage. Sir told us that if you are getting 50% result in an exam, that means you have only 50% knowledge. Even if you get 70% also, you are not 100% there. You are still 70%, and that quote stuck with me very much, sir. Every time like we keep the standards high because of the statement you made. Can you explain it to the audience?
Yes, exactly. One important thing is whatever we are getting through by taking these degrees is by only getting 40 to 50% of our marks are our performance. One thing what you are supposed to do is you keep on increasing your standards. You have to keep on increasing your knowledge. Every day to day you have to keep on increasing by the advanced surgeries what you are going to do. Even the knowledge of the medicine you have to keep on acquiring. so that it will make you more confident. Why? Because if you want to examine a particular patient, never examine as a surgeon. Suppose say I've called on for to examine one case which is a surgical case, but some of the times I will be making a diagnosis that, sir, no, this is a case of congestive cardiac failure whom you have made an call. I sometimes make a note that, so sir, this is the deficiency what you are going to miss it.
Okay.
So examine the patient as a whole.
As a medicine, as a doctor.
As a doctor.
First, not as a surgeon.
Not as a surgeon. First examine the patient as a whole. Yes, some of the times you may find that the patient is also suffering with some other disease which is not related to surgery also.
Surgery, okay.
So when you have more amount of knowledge, then you come to know that yes, patient is suffering with so other problems.
Okay.
So keep on increasing your knowledge. Not only that, I have got the 50% degree.
Okay.
I have one saying to say, there are two types of degrees. One is given degrees and another is taken degrees.
Yes.
What our faculty used to tell is, you are taking the given degrees, not taken degrees. Given degrees are when they want to pass you, okay, let them go pass. Yes. Okay. So that are the given degrees. Taken degrees, sir, I deserve to take my degree. Yes, I want this degree. This is my degree. These are the taken degrees. So what I want to tell you is, not 50%, score more.
Scoring more.
Even more. And not that is the year limit. See that you have more amount of knowledge to gain it.
Okay.
That is
so
more important.
As a teacher, sir, what was your perspective like? Because I've seen that you enjoy teaching students, clinical postings, taking classes, teaching us examination, which is very important. Understanding a breast case or a thyroid case, clinically diagnosed with mastitis or fibroadenoma or carcinoma breast, we learned from you, and you put in the passion to teach. Where does that come, sir, as a teacher? Because it's hard to balance both, but you do that.
No, one important thing what I want to tell is, I expect my students to be like me. This is the only perspective.
Okay.
I expect my student to do the same thing. If my student is there in front of any examiner, if the student is explaining what I have told line to line, I feel I am talking in front of the examiner.
Okay.
So I get tears from my eyes when I see my student performing in a better way than what I expect. So that is all what I will be expecting from. So I want my student do like me, not like a student who doesn't have the standards.
Okay.
So they should be more happy and the examiner should tell me, yes, your students are good.
That is why you are very particular about it.
Yes,
you want the student to perform with high standards.
Yes, I expect them to be like me.
Yes, that is very nice of you.
Even when I have my postgraduates, they used to tell, while opening this area, Sunil Sir will tell like this. So these are the vessels that you have to see for. Sunil Sir used to tell like this.
Yes.
One day I told my postgraduate, whenever you are doing the surgery, you will be feeling, I am doing the surgery. Then I used to tell him, if you turn back and see, you will not take your image, it will be Sunil Sir behind you.
The legacy.
So that is the shade that you are going to see whenever you are doing the surgery, because I used to teach my postgraduate very well. So I used to keep on explaining them in a best way so that they can do the procedures like me.
Okay, sir.
Not
sir,
like
and
others.
what do you expect a job of an intern to be, sir, like as an associate professor? Because it is the internship is the phase where we are choosing what we want to become for our further, and also advice for people who want to take surgery and what he should think in his internship.
Yes, during the internship I have a lot of students. Among this, when I went to an institute, I found that almost 7 to 8 girls are general surgeons. As an assistant professor, as an SR.
Okay.
Then after that I asked them, oh, very nice, I have been seeing you, so many people are general surgeons. Then they told, sir, you are the inspiration for us to become surgeon.
Okay.
So it felt very much happy for me that they are following me.
You want to be able to provide that to the students to take up surgery. Sir, what is the scope of surgery at this present? Because
actually,
with the robotics and with everything, where do you see, because you have seen surgery for the last 30 years, where do you see it go in the next 10, 20 years? Sir?
Yes, we have to learn robotics, and I've been doing laparoscopy. I have to enter into robotics.
We have to adapt to the change.
Definitely. We have to go for robotics. One thing is we need a robo, which is a costly issue. Once you get a robo, we keep on doing the things also.
It will keep moving ahead.
Yes.
It will not be an obstruction to us, sir, or it will assist us.
Never.
That argument will go on.
It
so
keeps
what
on
is your
going,
opinion on
No,
that?
always a surgeon is a good surgeon.
You
Robotics,
need a surgeon.
yes, okay, but patient want sophisticated things, yes, accepted. But good surgeons nowadays are very less. They want to depend on many things. No diagnosis by clinical examination. Everybody want to make diagnosis based only on their investigations, MRI, CT, HRCT, lot of things, money investigations. No, clinically you examine, you make your diagnosis 70% you are right, and 25% depend on your investigations.
Sir, and
That's
where
all.
does the patient care come from your perspective? Sir, you're a surgeon who's operating all the time, but I see you in the wards holding the hand of the patient, talking to them very nicely, and where that add up as a medical student? Is it how much important is that communication with the patient?
No, that is what we call it as a divine touch. People say doctor is a god.
Yes.
Not that. Once you touch the patient, then only they feel that yes, you are a god.
Okay.
If you keep on long distance and from there you keep on talking them, they may not feel good.
Okay.
Suppose you touch the patient, you talk to them, you hold the patient, then they feel yes, I am happy with the doctor.
Okay.
Most of the time. That
So
we
that
call what you call the divine touch.
Communication is very important with the
Communication,
patient.
talking to them, recognizing them. Yes, that is good.
Okay, sir. Sir, we'll do a rapid fire
Yeah,
round,
sure.
sir. Okay, so audience, I have prepared few questions for our Dr. Sunil sir, where sir has to answer very quickly. Okay, sir, I'll ask you a question, you give me the answer.
Yes.
Sir, which is the most difficult surgery for you?
Difficult surgery? Till now, no.
No surgery, okay.
Till now, no.
Which is your fastest surgery?
I have done appendix 6 minutes.
Appendectomy.
Yeah, cesarean section, 1 minute baby delivery. Hysterectomy around 9 minutes, specimen out.
9 minutes, specimen.
Then gallbladder, 10 minutes. Perforation, 14 minutes.
Okay.
Splenectomy, 20 minutes. I have got good number actually.
So what do you like more, sir? Scalpel or forceps?
Yeah, definitely scalpel.
Scalpel. You want to be in the action live.
Definitely.
You want to be the man who's taking over the case.
Yes.
If not a surgeon, what profession would you have taken, sir? If not surgeon.
Again surgery.
Very nice, sir. Sir, describe surgery in one word.
Surgery, passionate and dynamic.
Okay, passionate and dynamic.
Never go back.
Okay,
Never
sir.
turn back.
What do you like more, elective surgery or emergency surgery?
Not emergency, rescue surgery.
Rescue surgery, okay.
Suppose middle of the night someone call me, sir, I need your help. I will be more happy. Many a times I have a lot of calls in the gynecology department asking, sir, we have opened the bladder.
Okay.
Some of the time they say, sir, we have opened the sigmoid colon.
Okay.
There are a lot of additions, we are not able to do anything.
So you are
Then
ready to-
yes, I am very happy. I am doing this since 14 years.
10 years, sir. Okay, sir.
14 years.
Which is your favorite movie?
Favorite movie, lot many are there. Plenty.
Plenty. Okay.
Plenty. Yes, all the things which give a lot of confidence, such movies I see.
Okay.
I like KGF.
KGF.
I and my son, both of them, I have seen some around 200 plus times KGF movie.
Okay, 200 times.
Yeah.
Sir, which is your favorite sport?
Sport, like everything. Like I did basketball, volleyball, sprints, athletics, everything.
Okay, sir.
Nothing like.
Sir, love marriage or arranged marriage?
Yeah, love marriage.
Love marriage. Okay, sir. That was a very fun round.
Right.
Now we are coming to the conclusion of it. And so I'm very thankful, first of all, sir, for giving us this opportunity. You have always encouraged students, and through social media, now this has become the platform to interact with students or patients or anything. So we are doing it like this here. Thank you so much. And what is your advice to students, sir, who are studying?
Like
third
you
year,
have to be
final year students?
more passionate towards your profession. Don't waste your time. This is the ideal time to settle down in the life. And during this time, don't ever make all measures things, and keep on reading. And more importantly, more attention and planning towards your future. Like what is that you want to become, either a medical side profession or surgical side profession, and super specialty in that. Nothing like stand back with MBBS.
Okay, sir.
That will more, because competition is very high.
Competition is very high.
So super specialty is a must nowadays.
Okay.
If I get a chance, I may try back to go for super specialty.
Go back and do super specialty again.
Definitely, yeah.
Okay, sir. Thank you so much,
Right.
sir, for giving us this time, and
Right.
it's a very honor for me to be able to do this with you. Thank you
Right.
so much, guys. This has been Dr. Sunil, sir, and thanks for watching.
Right. Bye.